Good morning, Oklahoma. Welcome to Cow-Calf Corner. This week, we're fortunate to have Dr. Rosslyn Biggs join us, and we're going to talk about herd health programs for beef cattle. First, Dr. Biggs, why are herd health programs important? How do we go about implementing one?
So the first thing you need to do with the herd health program is really kind of establish some goals. As a veterinarian, my first recommendation is sit down with your veterinarian, not when it's an emergency, of course, but sit down with your veterinarian and outline what are the kinds of cattle you have in your operation and what are your goals for them. That can help establish, what kind of vaccination program do we need as part of that herd health? What kind of deworming regimen do we need to be implementing or monitoring? What are the biosecurity practices that we need to be taking? Perhaps diagnostic testing needs to come into it as well.
So we want to sit down with our vet and plan accordingly. When would we want to implement a herd program? When should it start?
Well, if you don't already have one, now's the time to start and have those discussions. But certainly with our breeding herds, we're a big cow-calf state. We need to revisit those plans at least annually. And the best time to do it is, in my mind, at least 45 to 60 days before you're planning on that breeding season starting. And so then that gives you a little bit of lead time, make some changes, and if you're going to, for instance, as part of your herd health plan, going to vaccinate those heifers 30 days prior to turnout or prior to breeding, we can make those changes then.
Is it a one-size-fits-all? Do my heifers, my cows, my bulls, my steer calves?
Right, it's absolutely not one size fits all. It may not be the same for you and your next door neighbor for both with breeding operations. And so you need to take the time, visit again with your veterinarian and outline back to those goals. What's the end point for these cattle? And what are you trying to achieve? What improvements are you trying to make? And how does that fit into your herd health plan? We have the question all the time, like, just script it out for me. It's cookbook, give it to me, and I'm going to do what you say, and it's not that easy, unfortunately. There are some parameters that are general, but it needs to be unique to your operation.
And so probably not just meet with your vet once, but remain in contact and think about things as we move forward in time.
Absolutely. It's got to be a commitment by the whole team for that herd health program. We need to, in my mind, we need to bring people that have the expertise, veterinarians, nutritionists, etc., into the group and develop that program together. And so we want to have those discussions and then, again, make those goals and try to achieve them in the next year. I think it's really critical to have the discussions well in advance. Don't wait for emergencies. Build those relationships with the team members of expertise well in advance. Have the discussions and reach out for education. Just because that's the way we've done it for the last several decades doesn't mean it's the best way to do it now. And so continual reevaluation of those herd health programs is really important.
Interesting stuff and very useful. I appreciate you being with us, and thank you all for joining us. We'll see you next week on Cow-Calf Corner.